I am Dr. Saqib Mansoor, and this is my channel Learning Anatomy, and I have to talk to you today's topic, and that is the interior of the skull, interior of the base of the skull. So the internal surface of the cranial base is divided into three large depressions that are placed at different levels. And these are the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. So here you see the demarcations of these three fossae, right? So I will talk in detail their boundaries of the three fossae and the bones forming them and the foramina present there and the structures piercing the foramina, passing through them. We'll talk about in detail. So this is the demarcation. You follow my laser pen. And first of all, I will trace the anterior cranial fossa. And from here, this is going there. This is anterior, lateral. And yes, this is the posterior aspects. You first trace that. Yes, this is the anterior cranial fossa. And right, so this is the most, shallow part. And then you see, this is the butterfly shaped. This is the middle cranial fossa. This is the middle cranial fossa. The butterfly shape. This is narrow in the middle and broader and deeper on the sides. So this lies at a relatively lower level than the anterior cranial fossa. Butterfly shaped. This is the middle cranial fossa. With the in the center, this is present, very important, the depression in the body of the sphenoid, that is sella turcica. We'll talk in detail all these things. And then this is the petrous part of the temporal bone, and here from here to here and to here, the occipital bones, and to here, this is a posterior cranial fossa. This is the most deepest, and the shallowest is the anterior cranial fossa. Then is the relatively deeper is middle cranial fossa, and the deepest one is your this posterior cranial fossa. With this, it's the depressions are there, and this is these are the for the cerebellar, hemispheres lie there, the cerebellar fossa, right? We'll talk about each fossa in detail. So the largest fossa is this posterior, as it contains a very, very important foramen magnum. So we'll move on, and these three fossae form the ball-shaped floor of the cranial cavity. Here you see this picture. This is a ball-shaped, right? Shape of a ball. Anterior, yeah, I told you already. Anterior, so ducking that way, anterior cranial fossa lies at the highest level and the posterior cranial fossa at the lowest level. This is the anterior cranial fossa. This is the middle cranial fossa, and this is the posterior, right? You identify this. This is this structure of the anterior cranial fossa. Posterior boundary is the sphenoidal crest, and this part here is the sphenoidal limbus. So this is that picture again, and now we'll talk about the anterior cranial fossa. Anterior cranial fossa, I told you it is inferior, and also the anterior parts of the frontal lobes of the brain lie in the anterior cranial fossa. Then this part, they lie, frontal lobes of the brain. And the bones forming the anterior cranial fossa, these are the frontal bones in this green color, anteriorly, frontal bones, and the ethmoidal bone, this yellow in the middle, and then the body and the lesser wings of the sphenoid posteriorly. These are the lesser wings. You see the red laser. These are the lesser wings of the sphenoid, and here is the body of the sphenoid, right? This part, this is the anterior cranial fossa. These are so maximum contribution is from the orbital parts. Here, the orbital parts of the frontal bones, where the frontal lobes of the brain lie, and it also form the roofs of the orbits. So let me enlarge the picture for you. Here you see, right? Here the bony landmarks are the You see first identification, then the description. This is the frontal crest, right? This is the crista galli, and this is the this is the crista galli. This is foramen cecum. This is frontal crest. This is a small foramen. This is the foramen cecum, and this is the crista galli. And in Latin, this means coxcomb. And this is the cribriform plate of the ethmoid with various foramina, of course, for the olfactory nerves. And this is the anterior and posterior ethmoidal foramina. There's two foramen there, right? This is the ethmoidal bone. And these are the lesser wings of the sphenoid. And this is the body of the sphenoid. Here, this structure is your prechiasmatic sulcus or the prechiasmatic groove, this one, which anterior boundary is formed by the sphenoidal limbus. This is the sphenoidal crest, I told you already, and this is the sphenoidal limbus. This is the sphenoidal crest formed by the lesser wing of the sphenoid. This is the sphenoidal crest, and this is the sphenoidal limbus. This is forming the anterior boundary of the sphenoidal of this prechiasmatic groove of the sulcus. This is the, so again you see, this is the sphenoidal crest and this is the sphenoidal limbus. So these are the some bony landmarks over here in the anterior cranial fossa. If somebody asks you what are the boundaries of the anterior cranial fossa, it's nothing difficult in that. You can say anteriorly is the this frontal bone, anteriorly and the lateral side, and posteriorly is the lesser wing of the sphenoid and the anterior crinoid process, and this is the prechiasmatic sulcus anterior boundary, which is also known as I told you already, sphenoidal limbus. These are the boundaries, and the bones forming, these are the bones: frontal bone anteriorly, ethmoidal bone in the middle, and the body and the lesser wings of the sphenoid posteriorly. And bones forming the anterior cranial fossa continues. I told you already, this is the frontal crest, a median bony extension of the frontal bone. I told you already, it's spotted. And the foramen cecum, this is the foramen cecum. I told you and showed you in the large form, and lies at its base, through which pass vessels during fetal development, being insignificant postnatally. And postnatally, in the adult, nasal emissory vein passes there. So crista galli, I told you, this is a thick median ridge of bone, lies posterior to foramen cecum, right? In Latin means coxcomb, like this. This is crista galli, very important bony landmark. So this is, I told you, the cribriform plate of the ethmoid. This is a sieve-like plate is present on each side of this ridge, the cribriform plate of the ethmoid on each side of the crista galli. Numerous tiny foramina here serve for the transmission of the olfactory nerves, which is a cranial nerve 1, concerned with the taste of the smell. From the olfactory area of the nasal cavities go to the olfactory bulbs of the brain, which lie on the cribriform plate. So that was all about the anterior cranial fossa, and now we move to our middle cranial fossa. So I told you this is butterfly shaped. You see, this is again, I trace quickly. Yes, this is the butterfly shaped. It has a central part which composed of sella turcica on the body of the sphenoid and a large depressed lateral parts on each side. The fossa lies postero-inferior. This is posterior and inferior to the anterior cranial fossa, which is separated from it by the sharp sphenoidal crests, and laterally and the sphenoidal limbus centrally. Laterally is the sphenoidal crest, and anteriorly and centrally is the sphenoidal limbus. Here you see, right? If somebody asks about the boundaries, you can see the boundaries of the posterior boundaries of the anterior cranial fossa form the anterior boundaries of the middle cranial fossa, right? These are the sphenoidal limbus, right? And the anterior crinoid process, and this is the sphenoidal limbus, right? So this is the boundaries, and this is from posteriorly it is part of the temporal bone, its superior boundary. At the posterior, this is the posterior boundary of the and middle cranial fossa, and on each side you see this is the part, this is the some part of the parietal bone, the lower part of the parietal bone, and this is some part of the this temporal bone already I told you, and this is the bone. Then somebody will focus on the bones forming the floor of the this middle cranial fossa. So the landmarks I told you already, the sphenoidal crest and the anterior clinoid process. These are the anterior clinoid process. So this is the limbus. I told you already these things. And now we identify the optic canals, right? They extend from here. Let's zoom in the picture for you people. Right, you see these are the optic canals. These are lying anterior to these anterior cranial process, and on its definition is on each side of the prechiasmatic groove are present the optic canals, right? And these are the bones taking part in the formation of the lateral parts of the fossa. In the center is the sella turcica. This is composed of three parts, going to mention soon. Greater wings of the sphenoids. These are the greater wings of the sphenoid. And the squamous parts of the temporal bones. There they go. And the petrous parts of the temporal bones. There. And so, right, 1, 2, and 3. And hence, here at the lateral parts of the fossa lie the temporal lobes of the brain. Here lie the temporal bones of the temporal lobes of the brain. So boundary between the middle and the posterior, I told you already, superior border of the petrous part of the temporal bone laterally, and the dorsum celli of the sphenoid medially. This is the dorsum celli. You see the laser. Sella turcica. In Latin, it means Turkish saddle. This is sella turcica, Turkish saddle. Saddle-like bony formation on the upper surface of the body of the sphenoid. It is surrounded by the anterior and posterior clinoid processes. And let's enlarge again here. Yes, here you see this is the anterior clinoid processes, this is the posterior clinoid processes, and this is the sella turcica. So three parts of the sella turcica. First is the tuberculum celli. This part is the tuberculum celli, right? And this is the hypophyseal fossa, and this is the dorsum celli. First we enlarge it, then we talk anything else. Here you see, this is the anterior part. This is the tuberculum celli. This is, right? You can say this is the prechiasmatic sulcus and its posterior boundaries formed by the tuberculum celli. And this is the hypophyseal fossa or the pituitary fossa in the middle. And this is the dorsum celli, which extend laterally into the posterior clinoid processes on each side, right? So we can say that this sella turcica or the hypophyseal fossa in the middle is surrounded by on each side by the anterior and posterior clinoid processes. Here we go. And next is the hypophyseal fossa contains, you know, I told you pituitary gland. And let's talk about four foramina in the body of the sphenoid. This is the body of the sphenoid, right here. This is the sphenoid bone, this body, and this four foramina forming a crescent present on each side, four here and four here. And their name are the superior orbital fissure, the foramen rotundum, foramen ovale, and the foramen spinosum. Right, so let's identify in a zoom form. So first of all, there is a superior orbital fissure. Here you see, this is a superior orbital fissure, and we go posteriorly to that, the foramen rotundum, and again, as this is going posterior and going again the lateral to that is the foramen ovale, and on we related to the foramen ovale, and we go lateral, and posterior to that is the foramen spinosum. The foramen spinosum is related with the spine of the sphenoid. So these are the four foramina. Again, this is the foramen rotundum, ROS, also known as mnemonic, rotundum, ovale, and spinosum, and this is the superior orbital fissure. So let's see the structures passing through them. Superior orbital fissure defined as a greater and the lesser wings, it's present between them. This is the lesser wing and the greater wing is present there. Leads into the orbit. And these are the structures passing through the superior orbital fissure. Here you could see three cranial nerves. First of all, this is the upper and the lower divisions of the oculomotor nerve, right? And then is the abducen nerve 6, and then is the trochlear nerve, right? And then the branches of the trigeminal nerve, and also this is the cranial melangeal branch of the ophthalmic artery, lacrimal nerve, frontal nerve, superior ophthalmic vein as well, right? And that is our inferior ophthalmic vein as well. So these are the structures, nerves and vessels passing through the superior orbital fissure. Then is the foramen rotundum, lies posterior to the medial end of the superior orbital fissure along the horizontal course to an opening on the anterior aspect of the root of the greater wing of the sphenoid and leads into the pterygopalatine fossa. This is foramen rotundum. And maxillary division of the trigeminal nerve passes through it, maxillary nerve. Then is the foramen ovale, the oval foramen. This was that. Here it is, showed you in the large form. A large foramen lying posterolateral to the foramen rotundum. It opens inferiorly into the infratemporal fossa, and the mandibular nerve passes through that. So that is the foramen spinosum. The spinous foramen lies posterolateral to the foramen ovale, opens into the infratemporal fossa as well in relationship to the spine of the sphenoid. I told you, and the middle meningeal artery passes through that. So now we talk about the foramen lacerum, and again you spot that foramen, right? The foramen lacerum. This is here. This is the foramen lacerum. This is the foramen lacerum. This here. This is lacerated foramen or torn foramen or the ragged. It lies posterolateral to the hypophyseal fossa and is an artifact of a dried cranium. Here. In life, it is closed by a cartilage plate, few meningeal arterial branches, and small veins pass vertically through the cartilage, completely traversing the foramen. The internal carotid artery and its accompanying sympathetic and venous plexuses travel the superior aspect of the cartilage. That is, these pass over the foramen, and few nerve travel it horizontally, reaching to a foramen in its anterior boundary. So internal carotid artery, right? And this is some structures over here. And a narrow groove for the greater occipital nerve extends posteriorly and laterally from the foramen lacerum on the anterosuperior surface of the petus part of the temporal bone. A small groove for the lesser pterygoid nerve is also present. So in the last, we'll talk about the posterior cranial fossa, right? And the posterior cranial fossa is the largest and deepest. I told you already, largest the cerebellum, pons, and the medulla oblongata. And this is a cerebellar fossa. I enlarge it for you. You could see this is a cerebellar fossa. Here is lying the cerebellum, this right and left lobes of the cerebellum, and also lie here the pons and the medulla. It is formed mostly by the occipital bones, right? This is the foramen magnum, and the occipital bones. This is of course present in the occipital bone. This you could see, right? So this is a large foramen. So dorsum celli, this is the dorsum celli of the sphenoid, marks its anterior boundary centrally, and the petus part and the mastoid parts of the temporal bones contribute to its anterolateral walls, right? This is central. This is the petus part of the temporal bone, And this is the mastoid part of the temporal bone. Some part of the, this is the part of the parietal bone. This is the mastoid angle of the parietal bone. So also you see, you can see there. From the dorsum celli, a marked incline called the clivus. So let's see what is the clivus. Is seen in the center of the anterior part of the fossa, leading to the foramen magnum. You can see, yeah, here you see, this is the dorsum celli, and this is an inclination, it's a slope clivus, right? This is the clivus that leads into the foramen magnum. So this is a very interesting picture. It's just a very interesting subtopic, structures passing through the foramen magnum. So university question for some students and the Viva question many exams with the structures passing through the foramen magnum. And I think it's a beautiful diagram shown for you. And its anterior narrow part passes the apical ligament. And then the upper vertical band of the cruciate ligament. And this is the membrana tectoria, or the tectorial membrane, right? And then this is through its center passes the lowest part of the medulla oblongata. This is very important. And these are the three cranial melanges, right? You could see this is sutura mater, right? And this is tura, this is the arachnoid mater, and this is the pia mater. These are the three, and this is the subarachnoid space. And many structures are passing through this subarachnoid space. We start from here. This is the anterior spinal artery, and on each side is the vertebral part, artery fourth part with sympathetic plexus, and this is the spinal root of the accessory nerve, right? And then on each side of the posterior spinal arteries, right? So this is various parts, structures passing through the subarachnoid space. Of course, is passing through the foramen magnum, and you see, don't forget the sympathetic plexus around the vertebral artery. Landmarks and foramina in the posterior cranial fossa. Posterior to the cranial fossa, the posterior is partly divided by the internal occipital crest. This is the crest. It's right, told you that this is the cerebellar fossae, and internal occipital protuberance. And here is formed the confluence of sinuses. When you will study the cranial, the dural venous sinuses, you will see the confluence of the sinuses. This is a point where dural venous sinuses merge, four of them. So there are also a groove for the transverse sinus and the sigmoid sinus. For that, we have to enlarge that. Here you see, this is C. Yes, you see here, this is C. Groove for the, the sinus various. This is the groove for the sigmoid sinus, right? This is the groove for the sigmoid sinus. And the jugular foramen, it transmits cranial nerves 9th, 10th, and 11th. And let's identify the jugular foramen. Yes, here it lies. This is the jugular foramen. This is the jugular foramen. This is the jugular foramen. Here, jugular foramen. Then is the internal acoustic meatus, the transmission of the cranial nerve 7th and the cranial nerve 8th, vestibulocochlear and the fissure. Here you could see this is the internal acoustic meatus. And then the last also identify this hypoglossal canal. Here it is. This is the hypoglossal canal. And through that passes the cranial nerve 12, the hypoglossal nerve. And these are the bony structures without colors, right? I told you already. And still I enlarged that for showing some parts of the structures. This is the sigmoid sinus, S-shaped, which ultimately here the internal jugular vein is formed through the sigmoid sinus, which transmits the whole brain. And the transverse sinus, this is a groove for the transverse sinus. So with this, I end this today's topic of the internal aspect of the cranial base, this interior of the cranial cavity. Thank you very much for being here. We'll be coming soon with the next topic very soon. related to the head and neck, and wish you best of luck. Thank you very much. And please subscribe my channel for my encouragement. Like and comment down below and share.